y'all? So I mentioned in my last video that that one of these topics needed to be further expounded upon, and I am just going to go ahead and get all this off my chest right now. This is going to be partly my own therapy today, I think. Um, so, are you sabotaging your physical therapy? There's one thing that, as physical therapist, I think, or at least I should speak for myself. There's one thing that for me is extremely frustrating when working with patients. And it's something that you really rarely hear anyone talking about in healthcare. It's something that's not discussed a lot, but it is something that I know because of the experiences that I've had with my patients, that this has or can have a huge impact on their physical therapy, as well as just their health care in general. And before I go into that, let me put an asterisk beside this and say there are this does not apply across the board to every single patient, because it can't. There are some patients that we work with who have dementia. There are some patients that we work with um, that have really significant health issues going on. I'm accepting those patients from what I'm talking about. I'm talking about the average patient in physical therapy. The average patient in physical therapy does not have those really significant conditions going on. Yes, we have those patients, and so I just want to make sure that I don't offend anyone or step on anyone's toes too harshly, because I am accepting from what I'm stating here, those people that have those more severe conditions, or those people that may have mental conditions that prevent their really uh, doing what I'm talking about. Okay, so there. That being said, let's get into this. So the number one thing, and the most frustrating thing that we experience with patients is patient passivity. People that are just completely passive in their care. You can probably tell it is a very frustrating to encounter patients that have that mentality. We try to help them with this, and help them to work through it, but it's those patients that consider that everything that's being done should be done to them, everything should be done for them, and they don't actually seem to think or consider that they need to do some things for themselves. They need to actually think and learn for themselves. They need us to teach them so that they can learn themselves. It's they oftentimes are wanting to be handheld through this entire process, and are wanting they'll do the exercises when we are with them that we're asking them to do, but if we're not there, the families are reporting to us, hey, whenever, if you're in home health, when you do the visit, you hear, well, yeah, when you guys come in, they do the work, but when y'all aren't here, they don't do any of the work. They just have a completely passive attitude about this. Or same thing in outpatient. You have patients come in, and when other family members come in, I've had before patients actually whose family members came in specifically to say, hey, he's not doing what you're telling him to do when he's at home. Um, no, this is not how physical therapy works. This is not how healthcare works. Um, if you are wanting to make progress, if you're wanting to recover, look, it's your body. This is your injury. If you're wanting to get out of this, you are the one that's going to have to do a lot of the work. You're the one that's going to have to learn. We can teach you, and we want to teach you. That's what our job is as physical therapists. That's what we're trying to do, is educate those patients. We're trying to show them, hey, this is what you can do to make this better. But you have to be a part of that process. You have to be active in your care. Stop acting as if you're in a boat floating down a river, that's leading to different healthcare destinations, and that boat has no way to control it. That boat, as if that boat has no paddles, no oars, that you can move it about. You, if you have that mentality, you're not going to have success with physical therapy, and you're going to sabotage your progress. That is not going to help you. Okay, you cannot be passive in that, in physical therapy and make progress. You can't be passive in healthcare and make good progress. I mean, there's some things, chiropractic care is a little bit more passive, and that can be beneficial at times. Um, you know, but you need to investigate things yourself. You need to learn about what medications that are being given to you by your physician. What are they? What effect do they have on your body long term? You need to learn why it is that you're doing the exercises that we're having you do in physical therapy. What is that going to lead you to? Your health care, and your, specifically for what this channel is about, your physical therapy care is not going to go well if you are not an active participant in the process. Your boat of your health does have a motor to it. You are able to move that motor, or move that boat along that river, and you do not have to go to particular healthcare destinations that you do not want to go to. You do not have to have, heart attacks. You don't have to have diabetes. You don't have to have things happen to you if you will actually be active in the process, and actually try to do the things that you're being told that can help you. As far as specifically physical therapy goes, it's you. Physical therapy, I mentioned in the previous video, this is hard work. It's hard work that you do. It's hard work that we do. It's not magic. It's not voodoo. It's it's work, and it takes consistency, and it takes effort, and with that, you can have astounding progress. I've had patients that have completely changed their lives, which I think I'm going to be doing a series on that, of just talking about some of the successful patients that I've had, and that I've worked with. And that's not to pat myself on the back or anything like that, but it's more maybe to have, or to carry on the inspiration that um, can be gleaned from seeing or hearing about other patients who were in similar uh, uh, similar moments of despair, similar moments of pain, similar moments of dysfunction, and how they were able to work through that and come out the other side successfully. So be looking for that in the future. I'm gonna do some videos on that, because I've had some patients that have just had miraculous recoveries, and they're awesome. But those patients did not get to that, and they did not arrive there by being passive in their care. They did not have that patient passivity that prevents so many people from making significant progress, or from making the progress that they could. So um, I'm trying to see if there's any other notes I had about this, because this particular thing I had to actually write down everything before I did this, just because I was like, I feel so passionate about this one thing that I might get all jumbled up in my words. But basically, the short of this is, the best way for you to move forward with your physical therapy care, and the one thing that you need to stop doing, is being passive. Be active in your care. Be consistent. Do the work. Show up. Try. Give effort. And you can make incredible progress with physical therapy, in a number of different, or for a number of different conditions and dysfunctions, in a number of different settings, whether that is outpatient, whether that's home health, whether that's skilled nursing, whether that's acute care. Okay, so no more passivity. Be active. Try. Work. Okay, and you can, Lord willing, get back to where you were before or even better than you were before. All right. So I hope that this maybe has been a little eye opening for somebody out there, and hopefully it will help you to maybe have a mental switch or a change in your mental process so that you can attack your physical therapy and actually make the progress that you're wanting to make. All right. Well, we'll be saying prayers for you, and look out for our next video. All right. Thank you.